It's a stark visual reminder that anyone can feel the deep effects of COVID-19.
A Toronto doctor sharing evidence of the virus's toll, particularly on young people. CTV's Beth McDonnell reports.
So what you're seeing is lungs filled with fluid.
It's one of the devastating impacts of COVID-19 on young people. Here, lungs of a 30-year-old sent to the ICU. This, a 35-year-old teacher infected with the UK variant.
They would have enormous trouble breathing. They would feel short of breath. They would look like extremely tired, which they were when we saw them.
Toronto ER physician Dr. Kashif Pirzada says compare the infected lungs to what they should look like. He shared the images to show how COVID is brutalizing the young.
I think all of us are kind of shocked at how young these patients are. What worries us is that people are unaware of this, that people are taking risks, they're going into crowded settings, but they have no idea how bad this thing has gotten.
The age of people with active cases in Ontario now heavily leans to those under 60, the highest group of people 20 to 29, with variants driving more than half the growth.
Coughing, trouble breathing.
On oxygen, this 33-year-old Toronto man works as a forklift operator. He went to Humber River Hospital Wednesday because his family doctor was frightened about his condition. He says he always wore a mask.
Yeah, I feel upset. How did I get this kind of COVID-19? I have no idea. Where did I get it?
Peel Region's medical officer of health knows people are tired of COVID. He says cases are still coming from workplaces, households, and more recently, clusters from social gatherings.
No matter how old you are, you don't know how your body's going to react. You don't know how your immune system is going to fight the disease.
Leaving doctors pleading, keep up with precautions, stay outside as much as possible, and hang on a little longer. Beth McDonnell, CTV News.